Welcome to my presentation on the Tuskegee study and ethics, law, and healthcare policies that resulted from the events at Tuskegee, Alabama. We'll start with a quick introduction of what was occurring at the time. It was the 1920s, and syphilis was having an increasing incidence rate in the United States. Through surveys, it was found that Macon County, Alabama, had the highest incident rates of syphilis than other counties in the United States. In 1932, the United States Public Health Service took advantage of these results and initiated the Tuskegee study of untreated syphilis in the Negro male, now known as the United States Public Health Service Untreated Syphilis Study at Tuskegee. The preliminary purpose of the study was to determine if there was a difference in manifestations of syphilis among Black males versus white males. The study was to be conducted over 6 to 8 months. It then turned into an observation of untreated syphilis that continued for 40 years. In 1932, the United States Public Health Service used flyers to recruit participants. They advertised a new health program that would treat bad blood, a vague term used to describe illnesses such as anemia, fatigue, and syphilis. The study included 600 Black men over the age of 25. 399 of these men were positive for syphilis, and 200 were negative at the start of the study. The men were promised free medical exams, free meals on the days they participated, and burial insurance. In 1972, Peter Buxton, an investigator associated with the study, voiced concerns about the Tuskegee study to the director of the United States Division of Venereal Disease and was ignored. He then leaked information about the atrocities occurring at Tuskegee to an Associated Press reporter. The Tuskegee syphilis study made the front page of the New York Times and quickly became public knowledge. Advisory panels, such as the Ad hoc Advisory Panel, began examining the study to determine its morality. The study was terminated in 1972. In July of 1973, a civil case was filed on behalf of the study participants, and the case was settled for $10 million along with the initiation of the Tuskegee Health Benefits Program for the surviving participants. During the study, the researchers failed to obtain informed consent. They did not inform the men of the purpose of the study or even that they had tested positive for syphilis. The study continued as an observational study of untreated syphilis. During the initial treatment phase of the study, some participants received arsenic, bismuth, and mercury as treatment. Researchers performed painful and invasive procedures on these men and exposed them and their families to undue harm. The researchers failed to maximize benefits and minimize harm to their participants. They did not provide them with treatment for their ailment, even after penicillin became widely available for the treatment of syphilis in the 1940s. The study violated the principles of non-maleficence, beneficence, and justice by causing harm to an already vulnerable population. The study also lacked scientific merit and did not contribute to society or the advancement of scientific research. Legal issues that arose from the Tuskegee study at the time related to the Nuremberg Code of Ethics. It was created in 1947 following the World War II experiments performed by Nazi doctors. These included informed consent, which there was no evidence of informed consent from participants, minimizing harm, which the experiment had a known risk to human life, well-being, and the knowledge of the transmission of the disease, and it was not scientifically validated. The study was deemed ethically unjustifiable. In the court case, the study was determined to have violations of wrongful death, deprivation of life and liberty, and conducted involuntary servitude. Several governing agencies for research development have been created since the Tuskegee syphilis study, starting with the National Research Act of 1974. The National Research Act paved the way for the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research and the adoption of the Institutional Review Board. They were put in place to monitor research studies and to protect human subjects, ensuring ethical principles and regulations are met and the rights of participants are protected. In the late 1970s, the Ethics Advisory Board was formed, and the result was the Belmont Report in 1979. The Belmont Report of Ethical Principles and Guidelines for the Protection of Human Subjects for Research outlined three basic principles in research: respect for persons, beneficence, and justice, all of which were violated at Tuskegee. The development of governing agencies did not stop there. Several advisory panels and councils have been created, with the most recent being created by President Obama. In 2009, he created the Presidential Commission for the Study of Bioethical Issues to review current regulations, policies, and procedures, and to continue to protect research participants. Even though many great protections have been put into place since 1974, there has been a lasting effect on society that has greatly impacted the racial disparities in healthcare that we see today. There has been a continued mistrust in healthcare system and a justified avoidance of participation in medical research by Black Americans. This mistrust in healthcare and medical research can be seen in the reluctance to seek medical treatment and vaccination during the COVID-19 pandemic. These lasting effects can contribute to the current and future health disparities we see in Black communities. Recommendations to prevent the occurrence of similar issues include knowing the principles and guidelines that our precepting advisory boards and ethics committees have outlined. Practice with autonomy, beneficence, confidentiality, justice, non-maleficence, and veracity in mind. Respect your patient's individual choices. Always do good and what is right for your patients. Protect patient privacy. Be fair and unbiased in how you treat your patients and provide care. Do not harm your patient's well-being and always tell the truth. Follow the Code of Ethics. Provision 3.4 of the American Nurses Association Code of Ethics states that nurses have a duty to be knowledgeable in the best standards of practice, to have knowledge of federal, state, and local laws and regulations, to know your organization's policies and procedures, and to address and report threats to patient safety. Nurses also need to be knowledgeable in cultural competency and practice cultural humility. By following these guidelines, we can prevent cases like the Tuskegee syphilis study from occurring again. Thank you for joining me today. I hope this presentation helped you to better understand the Tuskegee syphilis study and the violations of ethics, law, and health policy that occurred during the time of the study.